What is up, everyone, and welcome back to Athlete's Potential. Today we are going to go over one of our favorite lower extremity assessments that you can do. Now, this lower extremity assessment, or this lower body assessment, is going to be really good if you're struggling with getting at the bottom of a squat position, or if you're struggling with keeping your chest up when you do squat. If you notice that you're having to dip too far forward, or it's tough to come all the way down to the bottom of a squat position, this is going to be a really good assessment for you to do. Okay, and then I'm going to give you one drill that you can do depending on what you feel with this assessment. So hang with me, okay? So first thing that we're going to do, let's come over this way. So Marcus is going to, Dr. Marcus is going to show us his ankle mobility here. So the first thing that you're going to do when you're doing this test on your own is you're just going to lay your hand flat onto the ground. So Marcus is essentially going to lay his hand flat onto the ground, and he's going to bring his toes to the edge of his hand. So go ahead, Marcus. So hand flat. If you can get there, yep, perfect. And then now what he's going to do is he's going to try to take his knee all the way to the wall here. Perfect. And what he's doing a really good job of is he's not letting his heel pop up. He's keeping his heel flat onto the ground. So Marcus, let your heel come up. So if you notice you have to let your heel come up to get to that position, that's not what we want. So keep that heel down this way. And if you can't get all the way there, what I'll typically recommend is, so if he has the 4 fingers down onto the wall here, I'll typically recommend that you start dropping down fingers so that you can see how far away you are compared to where you need to be, okay? Now, say you're doing this assessment, and Marcus, take your knee all the way to the wall again, and say he's like, yeah, I can get there, but I have a really strong, like, pinching type feeling in the front of my ankle, right? That is going to let us know that we need to start working on joint mobility. Versus here, if he says, yeah, I get there, but I feel a really strong pull here or back here, essentially anywhere that's not in the front of the ankle, if it's all in the back, that lets us know that it's a little bit more soft tissue based that we need to work on improving to kind of help get you to the bottom of that squat position, okay? So go ahead and stand on that for me. So this is going to be for all of you that just did that assessment and you notice a pain or a pinch in the front of your ankle, okay? That's me for sure. I've had 2 ankle surgeries on my right side, and I definitely have a little bit of a loss of ankle dorsiflexion on my right side, so this is an area that I focus on a ton. So what we're going to do is a banded ankle distraction, okay? So Marcus, go ahead. So first thing he's going to do is he's going to get one foot up into the band here. And then when he gets that foot up into the band, next thing that he's going to do, and this is the hardest part really of this drill, is he's going to bring his foot up to the bench. So it's important to get that elevated so you can see this nice angle pull that he's got from the band here. Now, what's important about the placement of the band that he's got here is it's not up here on his shin bone here. It's the landmark that I'll give people is the tongue of your shoe. So he's really down here. This is called the talus that he's at. Okay, so he's right down here on this bone right here, and he's just going to give himself a little bit of overpressure with his hand here. Yeah, there you go. So he's going to give himself a little bit of overpressure, and then he's just going to rock forward, okay? So when he rocks forward here, what he's doing with this band and his position of his foot and his knee is he's giving himself a little bit of a distraction force to allow himself to get a little bit more of what's called ankle dorsiflexion, okay? So his tibia is able to advance on his toe here. And then he's going to rock backwards, and then he's going to come back. Now, another aspect of this drill that you can do is when he comes all the way forward, now he's going to kind of scour out a little bit. So he's just going to work on developing some nice ankle mobility and some free mobility at that end range position there so he can have some room to play. Because when we squat, we need our knees to come out just a little bit. Now we need freedom of movement down there. So again, that's if you feel that pinch in the front of your ankle, okay? Now, say you don't notice a pinch in the front of your ankle, but you notice a lot of pressure on the back of your calf here. This is another really good drill that you can do. Go ahead and step out of that band here, Marcus. All we need is a lacrosse ball, okay? So, Marcus, if you don't mind, actually, be my calf model for me and kind of come out this way, but then face that way. So, for Marcus here, so the 4 spots that you want to hit when you work on your calf is you want to hit right here. So you can see he's got this big muscle belly right here, and it comes and it attaches right here. You kind of see how it dips into this other portion of the calf muscle right here. That's going to be spot number 1, okay? Spot number 2 is going to be right here on the outside portion of his meaty head of his gastroc here, okay? So of his big old calf muscle right here. Then spot number 3 is going to be right here. And then so the same spot as on the outside, just coming over to the inside, and then we're going to come down on the inside of this same spot that we just talked about over here. So boom, 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 in a nice horseshoe fashion here, okay? Now, the movement that he's going to do with this, so go ahead, let's say you do a calf mobilization here. So he's just going to go to that outside portion of that upper calf there. And then what he's going to do, so he crosses that foot over. That's going to apply some nice overpressure down onto the ball to get a nice strong tack and stretch technique. So now, instead of moving his leg all over the ball, what he's going to do is he's just tacking that muscle down, and he's going to pump his ankle back and forth. Just like that. This is going to force that muscle to really move and stretch through a tightened environment and a tacked down spot there. So this is a really good drill for opening up the back of that calf muscle. Go ahead and relax. So again, you'd want to hit all 4 spots of that and then go back to the wall and retest your position and see if it gets any easier for you. You should definitely notice a difference. If you don't, that's not the right drill for you to do. If you're still noticing some pain or some discomfort with that drill or inability to do that drill, it might be time to look for a nice set of eyes to be able to make sure that it's not, maybe it's coming from your hips or your knees or some other area, because our whole lower extremity is a chain. The ankles is typically the starting point that I like to use a ground up approach. But yeah, go ahead, give that drill a shot, guys, and let us know what you think. Thanks.